Folks in, admit all. There we go. We got people that are coming in. Guys, welcome to the call tonight. This is going to be a powerhouse of a call. Man, I'm really excited, to do this and pull this off because it's something that I've wanted to do for quite some time now. But, I have the benefit in this space of having a phenomenal partner and phenomenal partners, excuse me, that are experts at what they do, documented, well documented, proven experts at what they do. And I'm just a dumb old Southern boy from Alabama, who figured out how to get involved and do it the right way and be three things: coachable, teachable, and a pleasure to work with. If you can master those three things, you have the tiger by the tail no matter what you do. And it's all three, not one of the three, not two of the three. You got to master them all in order to be able to garner people's respect, and then continue to want to pour passion into you as time goes on. And one of my phenomenal partners is, Ryan Early. This gentleman was a top 40 under 40, candidate in Oklahoma with some of the things that he was doing. He is the owner of Empire Genetics as well as Cantech Laboratories. And Ryan Early, he's my partner for Active Duty RX. He's my formulations guy. And the reason, Ryan chose me, like, for real, because like I could not in the beginning, like coming straight out of the military into this, there was no way I could step to a guy like Ryan, and whatnot. But what I did was I was coachable, I was teachable, and I was a pleasure to work with. I always showed up. I always brought people to him. When he was teaching them, I was sitting back and learning because I was getting a free education, myself. And I am extremely proud of him, in many ways. He was also the general contractor for Northwestern Oklahoma State University's industrial hemp pilot program. So he was leading the charge with a university off of feral hemp growing out in the fields, taking those plants in, doing research with those plants, finding out certain things. And because of one of the unique things that he did, he found a special terpene growing out there in the wild where, this hemp plant was unaffected by bugs or pests or anything. And it was growing and it was hemp. And he wanted to know why. So he was able to research that, find out why, and take that special terpene blend and put it into a product that's called Blue Magic now, which provides a bug shield, for plants. So I'm not going to steal all of Ryan's thunder. I just wanted you guys to know from the bottom of my heart, I really appreciate this dude coming out here. I appreciate him as a partner. I appreciate everything that he's done. So, with that being said, Ryan, can you hear me, brother?
I can loud and clear, sir.
There you go, man. Yeah, hey, we've come a long way since the back sitting out back in the it was the F-150 at Cantech.
Yes, sir. Yes, sir.
Yeah, man. Good times, good times. Well, I mean, I know you. I know you. I know your family. I know your kids. We do things together product wise all the time. I guess the first question that we'll ask, because people can unmute and ask questions as they want, and I want people to understand, guys, this is your time to ask questions. Like, we don't have a script, okay? We're out here to talk about legitimate, real issues, and you're gonna get some real answers. And I know Ryan and I know me. We both curse a little bit, but it's passion if it comes out. All right. It's not meant to, ridicule or humiliate anyone at all. We're just very passionate individuals about making sure that people know the truth. So with that being said, Ryan, like, so what was your background prior to, because there was something specific that you were involved with prior to getting involved with hemp, where you actually studied water or something?
Something like that. So my professional trade is a plumbing, heating, and air mechanical contractor. In the later part of probably 2010 to 2015, I really focused my company's efforts on developing water treatment, d different types of systems for different types of water treatment, mitigation of contaminants, um, and just really, getting into what is in our water. That was a big deal Still is a big deal. Most people don't know, and that's a whole nother Zoom we can spend hours on.
Yeah,
Because it's pretty crazy, right? Water is life. Without water, there is no life. So it was very important, and that led me down some pathways to work with some amazing people that were in some different spaces. I've always been an advocate of cannabis. I've been a patient since 13, and still am a patient. Right? It definitely has therapeutic benefits across so
absolutely.
many platforms. Right?
Mhm.
And that's really what's under attack right now by mainly lawmakers and elected officials that are either ill-informed, misinformed, or underinformed of a lot of things. And at the same time, there's a lot of things on the market. There's a lot of unsafe, untested product that is causing issues, and that's really what's caused this to come to the forefront. It's kind of out of left field when we talk about using it in a government ending of a shutdown. I don't believe that was the right place for that. I think that this has been needed for a long time, and we haven't really had an adjustment since the 2018 Farm Bill.
Mhm.
We're still running off of that Farm Bill, even though we should have had an update a long time ago.
Absolutely.
COVID, whatever you want to call it, lack of legislative initiative, whatever. There's it's been a wild year for everyone that's on here is probably in the industry or been around the industry. And I mean, it's been a pretty crazy ride just this last year. Texas
Mhm.
trying to ban everything. Now
Mhm.
the federal government throwing, this new bill up here that I mean, it did pass. It is law.
Mhm.
It won't take effect for another 12 months.
Right.
We have till November 12th, right,
Right.
before we're going to see legislative action as it sits.
Right.
Um, but, anyways, not to get too far into what we're
Yeah.
going on here about.
But so here's what's crazy. The first time when I caught wind of a lot of what was going to be happening was the last time I went to NOCO in Colorado earlier in the year. And ever since I left NOCO, I've been trying my best to tell people, hey, it's great that your states are gonna fight and they're gonna go down in a blaze of glory fighting. But it doesn't mean shit if it gets passed on the federal level because the states are they have to fall in line and they have to comply because states can be more strict but not less strict than what big fed wants. And I've been trying to tell people that, but man, that has fallen on deaf ears to the maximum extent possible. So during your time with the university, man, how was that being one of the first cats to be able to get your hands on some feral hemp and do some actual extraction, right, and some things with that?
Well, I mean, growing up here in Oklahoma, we were running around as teenagers, getting bread sacks full of ditchweed come October, November, right? For generations. As we got more into the research side of it, I mean, I wanted to know why. Why is it here? Why is it all over the state? Why is it on fence lines of farms that this clearly doesn't just appear here? This is left over from something much bigger, right? So I actually was the general contractor for Northwestern Oklahoma State University for 2 years. They gave me full rights to run my program. Of course, I had to fund it. They didn't provide any funding or grants or anything like that. This was a privately funded research project that our goal, our initiative was to go out and collect and categorize and
Mhm.
identify biochemical signatures of all of these different varietals. I mean, when you talk about Oklahoma, we have 5 different regions that are very prominent and very distinct in their climate and their soil composition. And that's why, the US government back in 1938, 39, and even into 40 came here to Oklahoma to bring genetics from all over the world. We identified cultivars from nearly every continent, minus Antarctica. um, and we're able to trace those genetics back. We were able to find some amazing things, some some of the plants that have been surviving here for the last 80 years on their own in the wild, right, have developed unique characteristics, whether that be stronger fiber
Hmm.
strains, whether that be a better resin for production of other things, whether that be the ability to defend itself against certain pathogens, predators, insects, pests. And I really, kind of zeroed in on that one. I found that fascinating myself as a natural alternative to current solutions like DEET and other things. And so we focused on that as far as internally primarily, and that's still a major focus of mine today as we move that forward. It is a pheromonal replication. Essentially, the plant had learned how to defend itself against some of these pests like mites, arthropods, and other, bad bugs we don't want to see, especially in our gardens.
Hmm.
Um, Even mosquitoes and flying insects that we don't want around us or our kids or our pets or our properties. Or so there's some great opportunities with that. We're still doing a lot of R&D to develop exactly what all we can encompass with that. So running the program was amazing. Like I said, we developed several different intellectual property pathways out of that, and even potential stuff that I'm sure long after I'm dead, someone else will find something right in the pile. There was just so much data that we can only get through so much of it
Right.
so quick. And of course, there's still a lot to go. So it's been
Now,
great. Northwestern's been a great partner. Just wanted to touch. They've been amazing. And we look forward to some future projects with other similar programs.
and just a little plug, if anybody wants to get involved, with Ryan, hey, Ryan, how do you want them to contact you if they have some legitimate, things, that they can work with you on, provided that they meet the criteria?
For sure. I mean, LinkedIn is great. I'm on Facebook. I have an Instagram. I don't get on there a lot anymore. You can always find me at through JJ, of course, activeDutyRx.com. Messages
Right.
there.
Yep.
Um, I mean, I'm around.
Okay.
I'm not a
Um,
hard fellow to find.
Na-
So.
you're a busy cat, and then another thing too, during that time when you were doing the research with the university, there was some pivotal legislation in Oklahoma that you were actually involved with the drafting of as well. I mean, what was that all about?
Well, I mean, I've been privy to be involved in several pieces of legislation as a lot of industry professionals and a lot of groups were involved in things before they were legal, right? Some of us got it out the mud, right? I remember a day of having to watch over the shoulder just trying to make CBD oil for epileptic kiddos in 2014, 15 here in Oklahoma. I owned a successful plumbing company. I wasn't trying to, go to prison for life because it was a Schedule One manufacturing of a narcotic, same charge as a meth lab in Oklahoma at that time. And so I did get with lawmakers. We did coerce legislation to allow a patient only by prescription only program, and that did allow us to begin manufacturing products. Really gray area. There was no license the state could issue for a cannabinoid manufacturer. But if we were only working through the proper channels and through legal pathways, it wasn't very long before we were able to draft further legislation, House Bill 1559, which ultimately allowed CBD derived from hemp and other hemp derived products, cannabinoid rich products, as long as they were within the 2014 Farm Bill at that time, which
Mhm,
required
mhm.
a university to be attached to the program to, you know, to to really provide some type of legitimacy, because at that time most of the CBD that was here in the United States was coming in from Europe.
Right.
I'm sure some of them on here remember the $10,000 and $20,000 kilo days of CBD,
Yep.
which was insane. Right now, it's obviously much more affordable. Now it is a moderately priced ingredient, in a lot of supplements, right? That's how it's marketed. That's how it's sold. That's how it should be marketed.
Mhm.
Um, and we've it's pretty crazy how far it's come in the last 10 years, even, right?
I find it funny, how far, it has come. And, with all of and by the way, if anyone has a question, they can chime in at any time.
Sure.
But, with the true definition and the true intent of hemp was not to make people high. It wasn't about getting people high, and because of a loophole, whether it was on purpose or not, I don't even care. All I know is if you're smart enough to mess with the science, you're also smart enough to leave it the hell alone. But some people got greedy. They wanted to do certain things, you know. So, I mean, where do you stand now? No, going from, us being able to, maneuver certain ways versus now no THC whatsoever. I mean, me personally, I think hemp should be hemp. But if it gets you intoxicated in any way, there's a place for you somewhere. You just can't call it hemp. I'm not sure where you're at on that.
Somewhere in the in between, right? So here's the deal. Let's look at, the law that passed. I mean, it essentially creates total THC limits, right? Which means all THC, tetrahydrocannabinols, their analogs, their precursors, right? So THCA, which is
Mhm.
really what most of this is stemmed from as of
Yep.
recent, right? Is those that are selling, weed as hemp and trying to say
Weed
it's
that hasn't been
compliant.
set on fire.
So that immediately, is going to affect that sector. And for those of you who are, cultivating, selling, distributing, products that contain a total THC limit over zero point 0.4 milligrams per package, that
Mhm.
is the legislation, right? Then you will no longer be allowed to do so under a hemp, regulated industry.
Mhm.
I believe that that's a little extreme. I believe that that pertains more to traditional industrial hemp for textiles, fibers, which to say that goes back thousands of years, right, to
Yeah.
ancient China, even ancient Samaria. We're using hemp all the way up until the U.S. government in the 30s and 40s.
Right.
Then all of a sudden we see this huge shift, and all this is bad. But hemp has been around, cannabis, let's say, has been around on both sides. We've used medicinal cannabis for hundreds of years. Originally, most strains of sativas were predominantly for rope, not dope, right?
Mhm.
And most of your indicas, which are found in India, hence the name, produce higher levels of cannabinoids, not really good fiber and herd, right? They were a medicinal plant. The hash, which then it was hashish. They were making hashish. They weren't rolling joints, right? They were making hashish, and they would either ingest it, modern, ancient edibles, or they would burn that in hookahs and other. But it was used by shaman. It was used in medicinal, therapeutic, and religious rituals. It was some some cultures described it as the gateway, a tool, much as ayahuasca, DMT, mushrooms. We can run through the list of natural psychotropics that have been used in some form or fashion for hundreds and even thousands of years. So there definitely is two sides to this plant, right? One side has fueled, housed, clothed, fed, healed many things, right, for thousands of years. And one side has been used for medicinal, shamanistic, sacrament, right, over probably the same freaking time. Be honest with you, just
Yeah.
different parts of the world.
Right.
So, there's definitely two strong points to be made for both. When we talk about what hemp having, I'll just tell you this: of the 100 11 plus strains we identified in Oklahoma feral, which would have been brought here by the U.S. government during their Project Hemp for Victory, which was what we titled our program as Project Hemp for Victory. Um, we discovered that there was not one strain growing in the wild in Oklahoma that was over 3.5% THC.
Mm.
And that would have been more of your South American sativas that were, a little stronger than your regular industrial hemp. They also don't provide very good fiber or herd. The ones that we found that produced little to no THC and less than 1 to 3% CBD even were some of the better fiber herd seed producers. So what's happened over the last realistically 50, 60 years is we've seen a hybridization of these two plants, one hardy, outdoor, multi-climate, accommodating sativa that's been bred with indicas that are typically not, and upping that THC level. And well, now we have 20% CBD that goes 1% THC and 30% THC that is THCA in the flower until we burn it
Yeah, yeah, yeah,
or
yeah.
heat
Yep,
it, right?
yep.
Um, and now we have something that we're trying to say is hemp because the USDA laws never wavered. It said 0.3%. They
Hmm.
just didn't specify whether that was pre or post decarboxylation. Many states did, right? Many states did not. Well, a few did not.
It's funny. I want to pause this right there because I want to share my screen with everyone real quick and show them something because it's so funny you mentioned that, dude, because this is an actual slide. Can you see that, Ryan?
I cannot, sir.
Oops, I forgot to hit share screen. Rookie mistake. Oops. All right, here we go. I got excited. I got excited that you said that. All right, now you should be able to see my screen.
Yep. Yes,
Okay.
sir.
So this letter right here came from the United States Department of Agriculture Secretary, Sonny Perdue, back in November of 2019. All right. And down here in this letter that came from them, I'll read the part down here in red. It says, and this was talking about when the USDA came out with their rules, right? Because the 2018 Farm Bill came out, then USDA came out with interim guidance, then they came out with finalized guidance. But then, a lot of people just totally ignored this document right here because it says right here instead of allowing similarly reliable non-decarboxylation tests to be used to measure delta 9 THC, the interim final rule introduced a new requirement contrary to the specific language in the 2018 Farm Bill that hemp samples must be tested using methods where THC concentration level reported accounts for the conversion of delta 9 THCA into THC. It says here specifically, as authors of the Farming Act of 2018 that was included in the 2018 Farm Bill, we believe strongly that this is a complete reversal of the congressional intent expressed in that law and requires testing that Congress specifically did not include. Requested fix. Given the 2018 Farm Bill specifically, and because it allows for flexibility in testing methods by allowing other similarly reliable methods, we encourage the USDA to allow testing for Delta 9 THC using methods that do not involve application of heat or decarboxylation to remove all requirements from or for converting THCA to THC. Like that's their letter, right? And right there, I'm thankful that because at this point I wasn't a partner in active duty RX, but I'm thankful that you can look at stuff like this and say, ooh, okay, THCA is going to be controversial. I need to stay the hell away from that. Post decarboxylation is controversial. I need to stay away from that in terms of product lines, you know? And dude, that was spot on. I don't know if you did that on purpose or not, but it was spot on.
Well, I mean, as part of a movement and at the forefront of things, I have to play by a very strict rule book when we're helping to shape these rules and educate lawmakers, educate physicians, healthcare providers, pharmaceutical companies, distributors. I mean, I can run down the banking industry, etc. We have to make sure that we are playing very much by the rules and being a standard, if you will. And I've said that for 12, 11 years now, that we're trying to set tomorrow's standards today.
Yep.
And it's coming. And for companies that have stayed on a pathway of not building their brand around isomerized conversions, or what DEA considers synthetics, for ones who have stayed around naturally occurring cannabinoids, even full spectrum products, we now, have a clear pathway that we will have regulation. We will have, the FDA has 90 days to publish a list, of what they consider naturally occurring cannabinoids, natural THC variants, cannabinoids with THC-like effects, and a definition of a container
Hmm.
for eventually the regulation of how many milligrams will be able to be in a container if
Right.
they change it. Currently, it's zero point 0.4 per
Right.
container. So
Yep.
all your now, let me back up a second because all of your synthesized compounds, delta 8, let me say chemically converted compounds because synthesized is a bad word. There is a difference in those versus marinol and, truly synthesized
Yep.
tetrahydrocannabinol. So there is a difference, but they're in the same category according to the DEA, and it is what it is. Your converted compounds have always been illegal, even in most states. Those already have language that say synthetic derivatives,
Yes, sir.
which means deriving a synthetic compound even from a natural cannabinoid, like converting delta 8 from CBD,
Yep.
right? That is not legal. And so, this, they should have done something a long time ago, right? The Farm Bill expired in September of 2025, right? And now we have fiscal year agriculture, USDA 2026 is what this limit on milligrams per package, right, of all tetrahydrocannabinols, is set to take effect
Hmm.
unless there's legislative intervention. That's
Yep.
why I say I don't believe that the ending the shutdown was the place to put this legislation. It
No.
should have been separate or in another agricultural bill,
Hmm.
not tagged to this because it was just hasty, in my opinion.
And then to give everybody, a bit like when that whole debate that was going down in Texas between, Governor Abbott and Dan Patrick, like I understood everybody's passion. I understood it. But there is a specific slide in my presentation that I was given by someone that I really respect a lot. And it showed me straight up, ooh, that's a problem. Whether people understand it or not, it doesn't matter. It's a problem because it's in the rules and people just aren't paying attention. And that slide looks a little something like this. This is what happened or what was going on, in Texas. Because, in Texas, the top, you have the federal, this involves the Controlled Substances Act, right? So on the federal level, the CSA, talks about, Farm Bill directed CSA amendment to the definition of tetrahydrocannabinols to be tetrahydrocannabinols, except for THCs in hemp, right? As defined under Section 297A of the Agricultural Marketing Act of 1946. Okay, that's on the federal level. But the state had their own definition of THC, the state CSA. And the state CSA, right here, it says tetrahydrocannabinols, meaning tetrahydrocannabinols naturally contained in the plant of the genus cannabis, except for 0.3% delta 9 THC in hemp, as defined Texas Agriculture Code 121, as well as synthetic equivalences of substances contained in the cannabis plant or in the resinous extractives of such plant and or synthetic substances, derivatives, and their isomers with similar chemical structure, and so yada yada. So right there, I know people didn't like Dan Patrick and his decision, but I mean, based on the Controlled Substances Act for the state of Texas, he was in line with that.
No, I mean it was just, again, it was one extreme to the next, right?
Right.
And what they need to do is to look at what's really, yes, geez, we're going to see multiple lawsuits, right, filed. They've already been filed. There's already, what is it, AK Futures versus Boyd Street, which is a Delta 8 synthetic case where it was banned. And then the Fourth Circuit, I believe, has a THCO case
Hmm.
already regarding DEA cannot change definitions without Congress approval.
Hmm.
So essentially, what's going on is this has been pushed back to Congress. Congress said, "All right, we're gonna pass this. We're gonna give it a year to take effect while we figure out how we're going to do this because that's really what happened when the Farm Bill was passed. um, there was no framework for regulation, so it's been open to interpretation, right, since 2018. And
Hmm.
this is the culmination of 7 years of non-enforcement or misguided enforcement in many cases, and then a turning of an eye to things that are right in front of their face. Like when I see an ad on YouTube for, THCA weed that looks amazing, right? Shipped to my door for $59 an ounce. I mean, what the hell? How do we know?
Yeah. Yeah, that's crazy, dude.
Crazy, crazy. And
It's
that's
straight
it
up
every day.
crazy.
And
And
so that's a,
no,
go ahead.
I'm sorry. Go ahead. No, I'm sorry. Please go
I was
ahead.
going to say that's a big thing that the FDA is coming in now, and we're going to see regulation framework designed over the next 90, 120, 160 days
Hmm.
regarding especially targeting packaging, branding towards children, safety, compliance,
Hmm.
tracking, GMP certifications, or at least GMP protocols in the facility where it's made.
Hmm.
Batch coding is something that everyone better
Yep.
get real familiar with.
Fact.
And the ability to produce the testing reports per batch very quickly and very easily on their package with a QR code or something similar, right? Like all that's coming right now. We all know this. Everyone knows this. Most know this. They're just like, all right, well, I'll change it when the time comes. Well,
And,
here's
and,
your wake up bell. Time is here.
Yeah.
You got to
And
use
and that's the crazy thing about it is like I've known about a lot of this stuff for a long time just from dealing with you in our conversations and our talks, and then an opportunity became available for me to get involved with Active Duty RX. And I'm like, hell yes, put me in the game, coach, because I
it.
know you've already got everything done. All I have
Well,
to do is jump in, have a good attitude, right? And just keep the momentum going that's already been underway. So I'm not gonna I don't want to bash cannabinoid. Okay, here's what I think. They waited too long to do something about it. They waited too long to speak up. They let this go unchecked for way too long. And because it went unchecked for so long, now you got all of these people who've made all of this money and they have livelihoods that are tied around this money that they made. And I think it's personally, I think it should have happened a lot sooner because it wouldn't be as big of a deal as it is now. But I mean, let's like childbirth, like seriously. Can you imagine having a kid that gets like 3 or 4 years old and then the government comes out and says, hey, we forgot to change, some rules back in the day about people having kids. So since we just changed that, can you take all of them babies and stick them back where they came from? No, it doesn't work like that. So the baby is here. You got to name it. You got to deal with it. You got to love on it. So, as much as I hate what's happening, it just took too long, to get to this point.
no, it
Well,
did, and that's
Oh, somebody
yeah,
was saying something.
let me ask a few questions if you don't mind.
Sure. How are you this evening, sir?
Good, good.
Good. Where you here from?
Uh, I'm I'm actually in Texas right now.
Okay. All right.
And
Okay.
see,
Yeah.
so
Yeah. So
I'm
you
I'm
look,
I'm
you in
I'm
the
well aware of,
you,
of how habit is. And uh I grew hemp and marijuana out in California. I had a 600-acre marijuana farm out there some years back, and I had one dispensary in Hawthorne, and I had one in Van Nuys. And
Mhm.
so and I did business for years like that. But and I know there have been a lot of changes, especially when a state goes from medical to recreational, it creates all kinds of problems. People have had problems like that. But what sounds like to me, what you guys are dealing with right now, because hemp that was under the 0.3% wasn't a problem, and people use that for textile and all that. It sounds like from what from Mr. Earlier saying, some people have decided to do a hybrid or some kind of cross hybrid of that, which is, created some other problems. But, was there a university study or a pharmaceutical study somewhere that was done to give to these people that's making all these rules? Because, a lot of times they just make up stuff from what lobbyists are telling them. It's not based on any science. It's not based on any fact. It's not based on anything. Or they'll do a study, but it's very directed. It's something that they paid somebody to write something very specific, and then
Mhm.
that's what they come up with. But and I'm not sure is because I haven't grasped at exactly where all this is going, but if it sounds like that it's going to be a challenge to what you're doing, one of the things you can do what we've done in the past is engage a university to get with the pharmaceutical company and do a clinical study, because as a clinical study that's done by university, there are waivers, even though there are laws and rules and regulations and policy that's set by FDA, it doesn't matter. If a university is doing a study on certain products, whether it be uh, hemp, whether it be the actual marijuana, since they're basically from the same family, there are waivers that can be done. And then you can have your research conducted that you use live, people, because you can't necessarily do this on animals and stuff. Now you can, but there's way beyond that. They've already got those studies done, and just say that you're going to use live subjects, and
Mhm.
then you can get around some of them doing like that, because this has come a long way, but it has gone unchecked a lot. The thing that gets me is how the federal government comes in and kind of tries to regulate how states process this, because actually states have more authority. I was a law enforcement guy for 32 years, and for 15 of those 32 years, I was a police chief. And
Okay.
uh, one of the things about the state that we was in, like in California, one of the reasons that the federal government didn't have a lot of power to prosecute people that possess marijuana or grew hemp or whatever, because if the state law was that it was legal and the federal said no, it's a Schedule I drug and we're not going to deal with that, or it's over a certain THC level, a lot of times the federal government, if it wasn't a trafficking charge or something specific that they had that Congress forbade, it would have to come through the state court. So the feds might arrest you, but it'll go through state court. And the state courts were mandated by the governor not to prosecute those cases. So that's why, so a lot of them just got thrown out. And the other thing is that I just want to put out here, the ex post facto law, there should be that if, for example, Mr. Early's been operating his business in a certain way and it's been above board, it's been legal, it's been according to everything that's written, one of the things that even if they pass this farm bill, this new one, certain things should be grandfathered. Has anybody even asked about that? Well, I mean, is that even some kind of consideration? I mean, I've kind of been out of that game a little while now, from what it was in California, because it's a lot different in Texas. There are things that
Right.
you cannot absolutely do in Texas that you can do in California, right? But
Facts.
so there's some things we don't even operate in that space anymore out here, especially. But have those things been considered? Because we did a lot of things. Because when I was doing it, I couldn't even put my money in a bank. Banks would not even accept our money. We had to have a safe, you had to have it built in. And then finally, over the years, we were finally able to start putting money in credit unions. And then finally, the banks opened up to it once they found a way to regulate it a little bit. But,
Safe Harbor Act.
huh?
The Safe Harbor Act.
Yeah, yeah, exactly. So I mean, brother, I feel you because I've been there, right? And I had to do all that stuff and go through all those things. And I know how regular, and then these corporations have come in, which just sounds like is a big part of your problem right now, and just complicated the heck out of everything because they want to squeeze the little guys out, and just get bigger and bigger and bigger. And they have a very, very strong lobby, so one of the ways you got to stay in the game is that you got to engage a university and a pharmaceutical company to just constantly do your research for you, or keep you in a clinical research trial.
Hmm.
No, absolutely. Um, there are a lot of studies done. There's more than enough data, especially when we look at European studies and
Mhm.
international studies on the medical and therapeutic benefits of all cannabinoids, marijuana included, right? Marijuana and hemp is just a slang term. It's all cannabis, right? Whether it's cannabis sativa, cannabis indica, or a hybrid of the two, it's all cannabis. And and again, this new legislation really won't affect traditional industrial hemp in any way other than it will allow, once regulations in place, and even with companies that are CBD and non-psychoactive cannabinoid based, as long as they have the data, they've been doing it right. Again, the more university relationships and studies you can get on your specific product or company, or genetics, etc., will definitely come to weigh. I think that regulation always means two things, right? One, they are going to mess it up because
And then it's money. I mean, that's
that's
that. I
what they
mean,
do.
the bottom
And
line
two,
is money.
Yep.
Yeah,
It's,
exactly.
you're going to have to pay to play. We've been
Yeah.
operating in an illegal or gray area, not illegal. I mean, 2019, I got a red letter from the FDA that said I am no longer allowed to sell food or beverage, CBD in food or beverage. I had a water company that we launched in 2017, and Quantum CBD H2O. It was the first CBD product to get placed in Costco, Anheuser-Busch distribution, Wegmans up in the Northeast, Giant Eagle, Kroger. I could run down the list. Like, we had all the all stars on the playbook, and well, we got a red letter that said they have not approved CBD for use in ingestion, right, or at that time topicals, and that we must cease and desist. And so that's about all it takes to end that deal, right? And that's been their position since 2019. That hasn't changed, though we see tinctures and gummies and even of just CBD products, not even psychoactive products. Those still don't have regulatory framework at a legislative level federally. We can't ship those out of country, right? We can't do a lot of things still. There's states that don't allow CBD to be sold at all still.
Mhm.
So this is going to bring forward regulation at a federal level. And for some, it's not going to be good. For those that have been playing in the shadows and dancing around the THCA limits and the synthesized converted compounds, their days are numbered. You better go get a marijuana license, right? Because that's what it's going to take to continue to do those. And even some states, those aren't legal for marijuana. Um, However, for those that are doing things right, this will provide regulatory framework for them to be able to be in a more traditional business setting. We one day hope to not even have to pay high risk credit card fees like we do right now if we want to sell a CBD product online, right? They hit us at 3.9. When if it was just a regular vitamin C supplement, it would be 1.9. So there's things that it will do to create benefits around some areas, and it will eliminate completely others.
One thing I wanted to throw out there too, Dr. Carter, just so you know, there's a lot of stuff me and Ryan cannot control. But the things that we can control and what we have input on, we've done a pretty good job of trying to do that. And one of the things that we have done ourselves, with the Active Duty RX brand, I'm just going to share my screen here again and go straight to the Active Duty RX website. So this is our website here, this section right here. So first of all, I'm trying to get Ryan to send me his bio information to put him out here, but he doesn't, he's got too much stuff going on. But there I am. Our third partner is Dr. Tristan Lai. He is an anesthesiologist, owns the Pain and Wellness Institute of Texas. He's an Air Force veteran as well, right? So, we're truly physician backed. Another thing that I did as well, right here, this section called QEEG study. Right. One of our products is called Clarity and Focus. It's 19 vitamins and minerals in one capsule. I know Theo knows a lot about it as well. 19 vitamins and minerals in one capsule, things like turmeric, moringa, ashwagandha root, N-acetylcysteine for accessing, energy pocket in the mitochondria of your cells, right? What I did, I paid for 5 combat veterans out of my own pocket for them to go have these brain scans or these QEEGs done. Okay. This was the brain cap. This was them out there doing their thing. This tells anybody who visits our website can actually go and view this information and just see, what's been going on. And right here at the very bottom, this is where Dr. Wilson was actually conducting the study. But anyone who goes to the QEEG section can literally go right here where it says download the full study. And if you want to see the results of how that went with those 5 patients, here's a study that here's the talking paper of what she wrote, right there. And honestly, I would love to see more stuff like this done as a whole, but here's the reality. I don't have the wallet to do this stuff big scale, but we are doing our best to try to help as many veterans, as we can, or people who have legitimate medical conditions that can be tracked. Also on all of our products, we've kind of, in essence, partnered with this company called Tetragram, and all of our products ship with a QR code on it. And people can go and actually scan that QR code, because there's a QR code that goes to the COAs that tell about, the quality of what's in the bottle. But there's another QR code that people can scan, and it goes to this app called Tetragram, where you can literally go and rate the products, how they're working for you, what were your initial symptoms, and how all of that works. So we're doing our best to gather data, right? Until someone comes along, or someone we can work with that's legitimate and is not trying to pull our leg, and willing to, invest a little bit more to help us get some more research across the finish line.
I just want to chime in real quick. Thanks,
What up,
JJ.
Theo?
Hey, what's up, man? Puts these talks on to better inform the public. From a veteran standpoint, I think we have majority of people on the call that are veterans, but Ryan has such a great product. When JJ came on board with Active Duty RX, started doing the studies, right at the same time, another gentleman that's on the call, Mr. Thomas Boxley, in Oklahoma, we were approaching the VA in Muskogee about proposing to do some studies. And they were very skittish about it and still are. But the opportunity for us to do this because of the cannabinoid and the antidepressant scare and the results of the long-term use and abuse of those drugs, they're a little bit more open to it. Here in Hawaii, I have been talking to Dr. Carter about approaching the VA here. We have the same opportunity. Just in the footprint, we have such a great opportunity to approach the VA and say, hey, we have a solution. We could be a liaison to this study group and actually use your evidence-based medicine centers to produce data that's going to help with the legitimate health outcomes of patients who take Clarity and Focus, Active Duty RX, or any of the other products that you have on deck, Ron. The Emerald has been great out here. I am a distributor for the products, for both product lines, all the product lines from American Wholesale Hemp here in Hawaii, and they do very well. It's just getting the information out to people is very important, and that is where the rubber meets the road. Because some people have tried synthetic cannabinoids or the fake stuff on the shelf, as opposed to something that's manufactured in the FDA registered laboratory with the ISO attached, a very high level, and very passion. A lot of passion goes into these products, the formulations. And I just think we have a real opportunity right now at this time, while the controversy is being spewed, to actually show data of real test studies or even clinical trials that would produce the type of information and momentum that we need to push into different industries. You guys can kind of address where we are in the industry as far as distribution and things like that, and some of the things that has happened with this product being that it's sold behind the pharmacy counter, but over the county sales. Now, it's just a high level opportunity for us to push this product out into the world.
And I think you are onto something key, Theo. And, as a veteran, I know what the sticking point is with the VA. As soon as you say CBD to them, they're going to think THC.
THC, right.
But see, here is the real. I used to be, Dr. Carter, I used to be a lab tech in the Air Force. I started out my career as a medical laboratory technician. So I know a little bit more about drug testing than the average bear. All right. And because I do, I was actually able to have some lab associates of mine send me some things. And briefing the VA could be just this simple right here, as showing them the cup, right? This is what a 10 panel looks like when you're testing for 10 analytes, right, within your urine. Okay. If we take that and we turn that to the side, well, there's THC, there's cocaine, there's amphetamine, there's opioids, right? There's MANP, there's PCP, there's barbiturates. The only cannabinoid that's on this 10 panel is THC. There's not even a spot for CBD. So initially, someone could be on a THC free product and it could potentially flag as THC, because this is just a straight piece of reagent paper that's being evaluated initially for the pre-screen. Now, I have not been able to look up everyone's rules, but I did look up the demand reduction program for the Air Force. And the demand reduction program, it states this, the second line that I've underlined here: specimens that presumptively screen positive will be confirmed by a chromatography or mass spectrometry analyzer. So basically, all that's saying is if you come up initially positive on a cup, now we got to take it and put it on an analyzer that looks like this. And this analyzer right here is an $800,000 analyzer. I know because when I owned the lab and we were affiliated with the testing laboratory in San Antonio, we had access to one of these, right? And this machine, you're looking at this machine, you're actually gonna it tells the difference between size and shape. So CBD and THC are similar in particle size, but they're different in particle shape. And this is the machine that actually shows that. But see, here's the problem: this to run this testing is way more expensive. This is an $800,000 analyzer versus this, $30, $40 cup. And they don't want to pay for the additional confirmatory testing for everybody who initially comes up positive. That's what it boils down to make a long story short, and why people don't necessarily get it or understand what it's all about. And that's why because they think you say CBD, they think THC, but nobody has the background to go in and explain to them very simply, like I just put it. And
Okay.
that's the problem.
I know a doctor that has been in the VA system as a physician and doing clinical studies for 30 years.
Mm-hmm.
Um, he's a forensic pathologist
Okay.
and a lawyer.
Okay.
And he has done extensive clinical studies over the 30 years, and he's built two universities. So there's also a study.
Mm-hmm.
That guy also has connects in the VA that he can probably, if he talks to you and find out what you're trying to do, help you navigate some of these landmines that you're having. I'm gonna send you his information. So,
Please.
send me, give me your email. I'm gonna text you his information tonight. I'm gonna text you his bio.
Yes,
And,
sir.
if anyone can either help you or point you in the right direction to, where you need to go, or if you're trying to find some money from what you need is the funding from a pharmaceutical company and from a university. Those are the
Absolutely.
people that have the deep pocket. I cannot imagine that with the studies that have been done so far, with veterans being helped with PTSD, anxiety, all these other things, especially with the beta testing that the VA did years ago, before we even got to this point. Dr. Koya has his own laboratory. You talk about an $800,000 machine. He has all of that stuff, and so that'll cut some of your costs because what you're paying for, because it's third party and you're not associated or really connected to those people. Dr.
Right.
Koya has that. He has a laboratory in Lincoln, Nebraska,
Mm-hmm.
that you just tell him what you want, he'll set that stuff for you.
I would
And
love to.
because it's for veterans, this
Absolutely.
guy worked in the VA system for over 30 years.
I'm a 21-year Air Force vet.
Okay.
So we'll get along like two peas in the pod as long as he was Air Force. Nah, I'm playing.
I don't know about that.
Theo, do you have Dr. Carter? Do you have Dr. Carter's number?
Yeah,
Or
so look,
because
I'm gonna send Theo his information and Theo can get it to you.
yes, sir.
Yeah, so I'll send it
Okay.
that way because I
Sure.
don't want to put it
Yeah, this is a recorded number, and if either one of
yeah.
us say our phone numbers right now,
Yeah,
that's
yeah,
gonna go
because
crazy.
I'll email or text it to Theo tonight, and then
Sure.
Theo can tell you, and I'm gonna let Dr. Okoye know that you'll be contacting him.
Absolutely. Thank you so much. I really appreciate that. I mean, and that's part of the reason why, I have people like Ryan out here, people like Theo out here, because this is bigger than just me. Like, I'm just a dude, but I know a lot of really smart people, and it's like, I don't need to know everything. I just need to know enough to put all the right people in the
Right,
right room and let them talk. And when they talk, I need to sit there and be quiet because I'm going
right,
to get a free education if I let them talk and not get in the way, you know?
okay. Well, I can do that for you, and like I said, I've operated in this space somewhat. It's changed a lot. It's changed a whole lot. And so, like I said, I can empathize with what you're going through. It seemed like it's gotten worse over the years instead of better because now they're trying to regulate everything even worse than we were back then. So, and
Well,
none of them know what they're doing.
to Ryan's credit, Active Duty RX has had zero problems
Okay.
since these THC bans have come out. The company is doing better than ever because our entire product line prior to a month and a half ago was THC free completely, no detectable levels of THC. We
Hmm.
incorporated one product that has less than zero point 0.3 delta 9
Hmm.
naturally occurring, and it's
Right.
heavy in CBN, to help people sleep.
Right.
So we're doing everything the right way, and it's been smooth sailing for us. And a lot of people don't like that, and I'm sorry they don't
Yeah,
like it, but
and
that's just
and, and that's
that's not my
strange because
problem.
now they have gels, topical stuff. They got all kinds of stuff because I buy these products myself, and you can go on Amazon and get a lot of stuff. So while like Mr. Early was saying, for people who are following the rules, that's who seem to have the problem because a lot of people just put it out there. But the problem also comes in with people doing this synthetic stuff. These things that are synthetically produced are bad. They're toxic. They're harmful. And those are the tests that they put out there and say, see, this is the result when
And that's
that's
not the majority of what everybody's doing.
right. Exactly.
Yeah,
Exactly. But that's the information that's out there. It's bad info. And like Mr. Early said, and Theo said, one of the biggest problems is getting people informed on what the truth is.
yes,
And
sir.
so
I agree.
maybe, this man can help you get some of that.
Well, I look forward to us talking more in the future, Dr. Carter. I will get my email address. My email address is James James at jjgro.com. Once
Okay.
again, James at jjgro.com. That way,
Got
anybody who puts me on any spam, I can mark their emails as spam and get them out
it.
of there.
Get it
Ryan,
out
what
of
were you
there.
about? Ryan, you were about to say something, weren't you, bro?
No, I was going to say, I have recently written two pieces at the administration's request. One on integrating natural medicines, products, etc., such as CBD, all hemp based, but also other ingredients into the traditional allopathic pathways, right, for overall healthcare. And the other one on sustainable farming conversion from more traditional practices. So we are getting some things in by request, but not so much getting through, right? Like Dr. Carter said, it's money. There's a lot of lobbies that are spending big bucks to drive policies as nothing else is new. That's how we got to this point to begin with, was during the 20s and 30s with William Randolph Hearst. And then later on with Eslinger, they demonized it because they were paid to do so.
Mhm.
And they're still doing that. But that is not the case with synthetics. I'm right in line with Dr. Carter. I believe that there's no place for those, at least not in an unregulated consumer market, right?
Right.
There may be needed some research. There are some compounds that can be converted into things that aren't naturally found that could show medicinal potential because let's be real, that's what allopathic medicine is synthesized compounds emulating plant effects, right?
Right.
So there very well may be some benefit to some of those downstream. I don't believe they have a place in the natural order of things.
Mhm. And I cannot, I've had veterans because a lot of veterans trust me, but they're not public with it, and I respect that because as a veteran and dealing with stuff myself, I appreciate it when a vet hits me up, sends me a DM and asks me a question. But I can't tell you how many vets come to me pissed off because they can't get THCA flower or they can't get Delta 8, right? And I'm like, okay, I understand
Legalize
where
marijuana federally, and
yeah.
we'll be good.
It's like I understand where you're at right now, but have you ever heard of this cannabinoid called CBG? They're like, what's
Mhm.
that? Right. And I start talking about things like CBG and other things, right? And then I'll send them one of my roll-ons, and then I'll send them a 30-day supply of the Clarity and Focus. And then they're like, damn, dude, I feel just as good as I did with that other stuff, and I'm not even high. And that's when I'm like, see, that's what I've been trying to tell you guys. It's
Right.
ways to get relief without the psychoactive realm. Now, if you don't get enough relief, non-psychoactive, go get you a medical card. If you're in a state where you can get one, cross over to the psychoactive, realm and seek additional relief at that point. But there's all kind of things that you can do from a medical standpoint, non-THC wise, with extra CBG, because that's kind of like the mother molecule in the plant. And I have a good friend of mine by the name of Dr. Terrell Newton, who wrote this book on the endocannabinoid system. And when you look at some of the casework that he's done and some of the studies, it's not a lot of high dosage THC recommendations. It's
Right.
very low
Very
THC
low.
with a lot of, CBD, CBD, CBG, CBGA, things like that, right? To get people the medical relief. So if physicians are writing books like this that are saying low THC, but add the others as well, why aren't people reading this? To get the true medical advice versus just, yeah, man, I need gas to feel right. No, you
It's the
don't.
recreational side. That's the
Yeah.
recreational side. Don't get me wrong, man. Working with patients in all aspects from about every sector, many patients need that immediate release of smoking. I'll tell you, I was told I need a double shoulder replacement 3 years ago. I've grown up racing motocross and sprint cars and everything else I could climb into and strap down on. And so my shoulders are shot. However, between natural pharmacology and sourcing things not traditionally, I avoided double shoulder replacement. I'm now at 100%. Um, it can be done without having to go take pills or pain meds, but smoking marijuana specifically, high level THC, did help the pain greatly, but that's not what healed the shoulder,
Mhm.
right?
No, no,
And,
no. And years back out in California and prior to 2019 and the COVID and all that stuff, when we were doing it, the VA had a beta program when they first started trying to help veterans before all this came out, and then they put out because veterans could not go to the VA campus because it was a Schedule One drug. So even though when they started, especially these doctors who were doing some natural medicine type of things, and they started doing that during that beta testing program, we were paid to deliver to veterans, especially who were non-ambulatory, if they got a state card from California that they couldn't get it from the VA campus, to deliver to those veterans so they can get those meds. Now, our area was from San Diego to Long Beach. So that was our travel area. And we serviced veterans in that area. So I find it odd that after all these years, but not so much, that we're still dealing with this same stuff because they were in a beta testing program. The VA paid us $600,000 to do that program to deliver to people that were not able to go get it from the VA campus because it was a Schedule One drug on the federal law, and they couldn't, they couldn't dispense it on the campus. Um, and then we also made a tincture from CBD, like Mr. Early is saying, you put 4 drops on the person's tongue that was having certain medical condition, especially cancer pain, right? We had a pharmaceutical company that was using that. They made it for us, right? So it was medical grade because we grew medical grade stuff, and they used it, and those people experienced the pain relief from just 4 drops in the morning and 4 drops in the afternoon. And the people that didn't have, if they were in stage 1 or stage 2 cancer, it really pushed that into remission. Now, if they were late stage 2 or stage 4, it prolonged their life a little bit, but it really didn't save them. But if it was caught early enough, several doctors out west did that. And now we've come full circle. This just befuddles me because we're still having these same conversations since 2014, since 2013, 2014.
We're
Tell you
in,
what, Doc. Oh
go ahead,
shoot,
Ryan.
go
I'm
ahead,
sorry.
JJ.
No, no, go ahead, bro. No, you're good. You're good. Please go ahead.
Gonna say it's because oncology is one of it. In the end, those studies, those beta tests were effective. They know that,
Yeah,
right?
they
Oncology
know.
is one of the. This is one of the only fields of medicine where the physician actually procures the course of treatment, the drugs, right, from the manufacturer and gets to sell them directly to the patient at a profit, a very good one. Typically, your copay is his profit. Just FYI. And it's one of the largest industries in medicine, right? Why is it only that big here in the U.S.? Because most other countries look at things like parasitic infection, hormone levels, blood vitamin levels, and they can effectively diagnose deficiencies, toxicities, etc., which are the two leading causes of cancer. My opinion, and again, I'm no doctor. I've worked with thousands of some of the most accredited oncologists in the world over the last 10 years. I am an allopathic, homeopathic, integrative educator. I've educated thousands, pharmacists, etc., on integrating not just cannabis but other natural vitamins, distinguishing that there are naturally sourced vitamin C options. Ascorbic acid is no different than the carbon compound that they use to make your oxycontin, right?
Mhm.
Same thing when we're synthesizing things. So um and cancer is, in my opinion, one of two causes, right? It's either parasitic infection or it is environmental exposure and toxicity. And while there's difficulties in treating cancers, especially naturally, in those environmental exposure cases, there has been unbelievable success in treating oncological diagnosis with antiparasitics and other natural supplementation of things, such as the Joe Tippins protocol. Joe's a good friend of mine. His mycancerstory.net is where you can find his story. And now there's over 150,000 people that have followed the protocol of using. Well, it was actually the Emerald that Active Duty has on the website available today. We've been manufacturing that since 2017.
It's called the
Uh,
Moab on our website. It's the mother of all
it's
botanicals.
the green one, the green one, the green one. And so that was what Joe himself utilized during his treatment protocol, in conjunction with fenbendazole, vitamin E, and high dose, high purity curcumin. He was stage 4 diagnosis pancreatic cancer that had metastasized to nearly every organ in his body and was given 6 weeks to live when he first heard this quack theory of taking, antiparasitics. And then, of course, cannabis, in my opinion, cannabis oil, cannabis plants, especially with certain terpenoid profiles, are very antiparasitic, which is why we see patients who consume raw cannabis oil begin to heal rapidly, as to where others need it to smoke it for the nausea. Right. That's probably the most effective anti-nauseatic. I recommend that for everyone from pregnant women. And people say, what do you mean? You reckon a pregnant woman smokes pot? Absolutely. Because the alternative are deadly. And I speak this from the heart. My daughter is in a lawsuit. Actually, she's 17 now. She had full open heart surgery at 4 years old because Zofran was prescribed to her mother while she was pregnant, which they still prescribe to women today for pregnancy and nausea, knowing that it causes heart defects such as overgrowths, etc. And so they had to go in at 4 years old and open my little girl up when the doctors wouldn't let her mom smoke pot with her. Right, she did with my first two. They came out healthy as can be, no issues. They were drug testing her. This would have been 2007, 8. There was a big push on that about that time, and so she did not smoke. She was terribly sick. And Zofran ultimately did help with the nausea, but it nearly killed my baby girl. So Pregnant mothers, you'll hear me say it. Absolutely. Look to cannabis before taking a synthetic petrochemical pharmacological product that may or may not cause life-threatening issues to your child. Just read the warning label and take it to heart. Take it seriously because they wouldn't tell you it has that ability or chance of that risk if it didn't.
There's one more thing that I wanted to add, going back to what you were asking Dr. Carter about how it still baffles you that, we're still where we're at. I look at things from like everybody's up here with it. I have this gift and this talent for looking at things down here, right? And I actually teach a hemp 101 seminar where I go over all the basics of the cannabis plant. Like I talk about rules and regulations, I talk about cannabinoids, I switch gears and talk about the industrial purposes. I talk about, testing the plants. I talk about drug testing. Those were slides that I just showed you. And I give people tips and tricks of navigating the space as well. And I don't think enough of that basic education because see, people will come in and educate, but they'll educate on a part of the plant that makes them money and they'll call that a hemp seminar or hemp. No, that's wrong. You got to come in and educate on the whole plant all the way through. And when you do that, you can capture hearts, you can capture minds. People start to thinking about things that they never thought of before because they didn't even know that you could do X, Y, Z. And I think that's part of the problem is, look, I need some funding to travel around the United States and do that thing continuously. When you email me, I've put the link on YouTube. So when you email me, I'll send you the link and you can actually go review the whole seminar yourself and see if it has any credibility and how I tie everything together. Because the purpose of that seminar is for somebody who knew nothing about it to be able to leave after consuming that information and go to any gas station, dispensary, or whatever, and at least know indica from sativa. You don't go to a dispensary looking for hemp wood, right? That you're not going to find that. So people get enough of the basics to where they can start to safely navigate. They know what COAs are and how to read them and things like that. And I don't think enough of that basic education has happened at this level because everybody wants to talk about this stuff. And I get it. That is depressing stuff. But it's going to take so much longer to get there if people don't understand the basics first because they'll lose interest up here if you don't take care of those basic terminologies first. And I think a lot of that's what's happening.
I
Oh, you
see
guys.
there's a few other people on here. Does anybody have any
Yeah.
questions? I mean, I may or may not have an answer, but I'm happy to
I
give you
see
my
old Bobby.
opinion.
I see old Bobby Isabel's speaker's been unmuted for a while. What's up, Bobby? How you doing?
Not much, just hanging out, enjoying everything here.
Okay, all right, okay, all right. Well, didn't know if you had
The
any
usual.
questions or not.
No, I'm here to learn.
Okay, well, thank you so much for coming out, man. I really appreciate it.
It's been great. I enjoyed it.
Yeah. Let's see who can I pick on. Ooh, Misty. Misty, we actually chatted about this talk earlier in the week. So do you have anything that you want to unmute and ask about?
Yeah, I guess when we were talking about the cancer stuff, just to add to that, if you know who Bonnie Goldstein is, Dr. Bonnie Goldstein out of California, she's the physician's physician and expert on using cannabis with children who have developmental problems. And, she speaks a lot about how you can't compare recreational use marijuana to cannabinoid deficiency, which is Dr. Ethan Russo's work on. And so when you talk about cannabis during pregnancy, she talks about how critical these cannabinoids are to brain development in the womb.
Yes.
And again during those fundamental teenage years when children get another big leap in brain development. And we know it's a neuroprotectant. And there isn't enough emphasis on the human developmental side of things and how these cannabinoids and the endocannabinoid system is directly related to reproduction and really survival of our species and human development. It's the cannabinoids are in the breast milk. It stimulates
Yep.
the human suckling reflex. It's the cannabinoid receptor that is responsible for the fertilization of the egg. And so I think I mentioned on one of your posts, I am happy about how cannabis has exploded people who wouldn't normally pay attention to natural medicine, and they're bringing it to the forefront now because they're realizing that supplements added to their CBD concoctions can have this complementary interplay.
Right.
And I like that, but I also feel like there's a lot of people in the industry that are in it from the recreational side and they don't have no background in natural
Yep.
medicine. And
Yep.
so when they put things on their website like these cannabinoids have to be decarboxylated in order to be biologically active, drives me crazy because there's a lot. What about the other 699 chemicals in the plant? Yeah, that applies if you're trying to get high for recreational use, but
Right.
that's not true for all the other wonderful medicinal and therapeutic compounds in this plant, including the terpenes that you're
Right.
probably burning off.
Yep. Yep. Absolutely. It's
And so
maddening.
my theory is let's keep the plant in her holistic original natural format where she gave us this beautifully balanced product. And even the marijuana today doesn't have CBDA in it.
Very
Mm.
little,
And
very few strains.
it's scaring people away. We have this opportunity to have done it the right way and truly educate people on how important this is. And you see these regulations being made because of the recreational side of it and marketing of it.
Mhm. Misty, here's a question for you. If anybody has any questions directly for you, what is the best way for them to contact you? Do you have an email address or something you want to leave?
Sure. Mrs. Painault at gmail.com.
Oh, you're gonna have to spell.
MRS.
You're gonna have to spell that.
Yeah. MRSPOEHNELT at gmail.com. But I own Black River Hemp Company, but I don't distribute out. I am basically just take care of my local community. I have a brick and mortar store here that's very small and very small batch what I do.
Mhm.
But my background is holistic and functional health. And I've studied natural medicine my whole life, including this plant well before it was,
Before it
before we
was
had this
cool.
opportunity. But my, this recent, amendment or whatever to the 2018 Farm Bill is a very misinformed, I'm assuming, uh, reason why it got passed because just first of all make the plant legal, okay, and regulate it the appropriate way and get the people on board and the experts on board that have been doing this and that are in it for the right reasons and get them to help guide the law because it seems like they're all over the place and they don't really know what they're doing, right?
Mhm.
And yes, there needs to be regulation, but this would make my product illegal. and
Yeah.
and I do solventless rosin, and I'm not even gonna use the word invest because I don't even feel like that's the right word. But I'm not gonna spend money to change and alter the plant and take out and remove the THC, you know, and and
Look,
if they want it to be natural in its natural form, that's not the way to do it, right? Like in its complete wholeness. And so, not
Mhm.
saying that there's not a place for all these different types of customs there is, okay? There's a place for it. Absolutely. I understand that. But I'm very holistic when it comes to plant medicine. And the Mother Nature gave you what you needed, and we need to
mhm.
preserve the wholeness of it.
And that kind of piggybacks, what I've been saying, what I've tried to convey all along. There is a place for, cannabinoids. There's a place for intoxicating cannabinoids. There's a place for synthetic, cannabinoids. It's just when you look at the original intent of hemp and what they were using it for, and things in the United States starting to take off like hempcrete, hemp plastics, clothing lines and stuff like that. There's got to be some kind of delineation between the two, because people have been doing some sneaky stuff under the guise of hemp, messing with the science, and that's got to stop. The best way to do it, I don't know. but it's got to stop.
Well, and if anything, at least it should have been in black and white.
Mm-hmm.
It wasn't black and white. It was left open to vagueness and subjectivity.
Mm-hmm. Yep.
And that's why we have the market that we have right now. And I don't think that it's, we could say illegal or when Congress passed that bill and the president signed it, it does specify only Delta 9 THC.
Mm-hmm. Yeah, it
Well,
does.
and it says you can have isomers. That's fine. Basically they legalized marijuana when they did that because that does Delta 9 is not the same chemical compound as THC. THCA, you don't get high on THCA.
Nope, you do not.
It's transformed into a different chemical. Well, how do you think the chemical companies have been and the pharmaceutical companies have been functioning all these years when you see your pots and pans that say, oh no, this is POA free and PFOA free? No, it's not. All they did was move two carbon atoms over on the molecule. It does the same things, has the same property, has the same toxicity, but because they, by federal law, now created a chemically new compound, they get to make that claim that it's PFOA free. That's not illegal. That's the way it
Mhm.
works.
Yep.
So by not including THCA in the original legislature, they made THCA legal. And when you're
Yeah,
selling it in that form, if somebody changes it, they've now created their own new chemical compound that includes Delta 9. So I will not sell THCA flower. I will not, because I don't want my customers going to jail.
Good on you.
It's legal for me to sell it, but that doesn't mean that it's legal for them to have it. And Wisconsin's a very strange state. You can buy fireworks, but you can't light the fireworks off unless you got a permit to.
Hmm. Ryan, you would be screwed for your celebration.
Well, I have had fireworks confiscated. They just they
Well,
just
I love
they just took my stash, though. There no harm, no foul. But
well, I love living in Oklahoma. It's the freest piece of dirt in the world. And people say, "What do you mean?" I said, "We have more freedom here than anywhere else in the world. This is the only state in the country you can walk down the road as a female, topless, smoking a joint with an AR-15 fully loaded on your back." And they did it. They did it. So,
Wow.
the like you said, Tennessee, a couple of other states have messed up. They didn't continue with the true intent of industrial hemp, which traditionally doesn't have much THCA in it, or Delta 9, very little. Like I said, nothing we found over 111 strains here in the wild had more than 3% THCA. Um, and so, now obviously you're not buying anything that's coming from anything that's 3% THCA. It's more probably 20 to 25,
Yeah.
which is all genetically altered cannabis, right? And that's been a lot of my educational pieces. There's nothing being grown right now that's heirloom. It's all genetically modified. I don't care what strain you're getting, unless you're sourcing through specific banks under certain countries' regulations that have been letting been continuing to grow cannabis for hundreds of years. Have never stopped.
Mhm.
Very few, but it's all genetically modified now. Call it marijuana, call it hemp, call it whatever you want. It's cannabis, but
Yeah.
we didn't used to have highly producing cannabinoid profiles of genetics until just really the last 40, 50 years.
Yep.
And with CBD, the last 10, 12.
Ryan,
Man.
Um,
do you know? Oh gosh, I cannot. I'm sorry. I'm having a hard time remembering the name of his company and then his last name. But his first name is Jerry. He's out on the West Coast, and he's been collecting landrace seeds for a long time. So I think if you want, like true wild cultivars, that's your guy.
yeah. No, I again, I'm not really actively running. I've got my genetics bank stored, and I mean, We're going back through things little by little. It's a lot. Licensed some genetics out early on for some fiber and herd producing strains and a couple of cannabinoid strains. We did find one here in Oklahoma that produced almost 4% CBGA
Oh wow.
and zero detectable THCA, and under point 0.1 CBDA. And so that one's been one that we've kept pretty close and utilized for a lot of the CBG that goes into some of the products my other companies manufacture. Um, but like I said, traditionally, unless you bring them inside, give them love, keep them free of pollen, free of bugs, hit them with the nutrients, CO2, you're not getting what was typically available 50, 80, 100,000 years ago, right? It's definitely modified. And again, I'm all for some of it.
Man, I just looked at the time and realized we've been out here an hour and a half, y'all.
Yeah, I might
um,
have a question, JJ.
sure, what you got?
I just finished radiation therapy Friday there, and I was looking for maybe a product y'all might be having there for after radiation.
Are you looking for something topical or something to ingest?
Probably ingest, but I've been smoking for the nausea too.
Okay. All right.
But that's the reason I joined too, and was growing.
Well,
And was growing earlier too.
I'll tell you, Bobby, when we look at like a CBD product, CBD, CBG specifically,
All
pre,
right,
post, during radiology, we're mainly trying to offer neurological cell protection, right?
need
The
that.
U.S. government protected it, patented it as a neuroprotectant. I think
Yep.
Misty mentioned that earlier.
Mhm.
Um, so we know it's going to help provide neurological protection, right? And I was the keynote speaker 2017 for the American Epilepsy Pediatric Symposium,
All right.
and one of the first to really talk to a large group of pediatric neurologists about how these cannabinoids can interact and other compounds that we can introduce to increase or alter that. Um, but and then inflammation, right? Because I mean, if you're going through or just completed treatment, you definitely are inflamed. Um,
Definitely.
and so,
Urinary and
um,
rectally.
yes, sir. It's
And
what was your diagnosis? What specific? And again, I'm not a physician. I work with many
it,
of them,
it was
but
type 2 prostate cancer.
okay. I mean, my father-in-law just went through. He was stage 3. I believe his prostate was enlarged to 16 millimeters at one point, or 6 centimeters at one point.
Yes.
Millimeters. It was massive. It's now down to under a 1.
No, that's
His
right.
PSA,
Cut the blood flow.
and that's using a full spectrum, full extract cannabis oil. I wouldn't call it RSO because there's a big difference in RSO and a full extract, right?
Yes, sir.
Um, but a quality full spectrum extract, and then of course a specific protocol of a few different natural supplements to again regenerate new cell growth, because that's what we have to do is regenerate our bodies before, whether it be parasitic, and in my opinion, prostate cancer is a parasitic,
I would think so
um,
too.
parasitically induced cancers. So I would ask if you've ran an anti-parasitic protocol recently. And if not, then I'd be happy to point you in the right direction. There's several of them that are available that again, Joe
I
Tippins
would,
has a great one.
I would need that information, sir.
Okay,
How does
we'll
he
make sure.
how's he go
With
about
that,
getting it? How's
I'll
he go
send it
about
to you, JJ.
Okay, yeah,
I'll send you a few links that are, again, Joe Tippins,
mhm.
mycancerstory.net.
All right,
Joe's a good friend of mine.
sure.
Worked with him on several projects. I'm glad he's still with us.
Mm.
um, but I definitely think that, and that's really what we're trying to, when you go into radiology, they're trying to kill the parasites in your body without killing you. Um,
I got
in
close.
most cases. So, yeah, it sucks. I feel for you, brother. I do make a cream that is a topically applied cream that we've had at MD Anderson since 2019.
All right.
Um, I'll have JJ send you a link on where you can find that at too. It's amazing for radiation burns. I've got a lot of data behind it on breast cancer treatment.
Is this something separate from the PCRX?
Yes, sir. Yeah.
Okay.
Yeah, it's a separate cream. It's vitamin E rich. There's a few things in it that's pretty good.
Yeah,
Miss Mary McCary can speak very well to it.
okay. There is spotting in the rectum, rectal bleeding.
Yes, sir. Oh yeah. That's another one that we have a topically applied product specifically for sensitive areas
Yeah.
that have been treated with radiation. So
Correct.
yeah, I'll have JJ send you some links for sure, sir.
That'd be awesome.
Cool. Sweet.
Thank you very
Well,
much.
does anybody else have anything else? Any more questions before we disconnect? Ryan, I appreciate you giving up as much time on a Sunday evening as you have. I appreciate everybody's time.
Sure.
I always want to be respectful of it, but I wouldn't be giving you your flowers while you're alive, man, if I didn't give you an opportunity to come out and let people know who you are, what you do, what you mean to me, what you meant to the brand, and just what you mean to so many people that just they have no idea because you're just so low key, But I think more people, need to know your story and what you do, and it's just a matter of time. So definitely thank you for that. Thank you for everybody who actually showed up. We got someone who just came out, but yeah, we're getting ready to disconnect. So this is a recorded call. So as soon as the recording uploads, I will be posting it on all of my pages for all of the states. So that way everybody who wasn't here can actually see the information as well. And like I said, I appreciate everybody's time. I know Thanksgiving is coming up next week. So let's get to the gym Monday, Tuesday, maybe Wednesday, and then just turn into a fat kid for the rest of the week. All right. So
I'm gonna start early.
There we go.
well, anyway, I hope everyone has a good evening. And Dr. Carter, I see your email and I'm going to respond to that shortly. And yeah, so y'all take care. Y'all have a good evening. And if you need anything, let us know.
All right, thanks a lot, JJ.
Thank you.
All
Have a
right,
good
no
night.
worries at all. Y'all
Thank
take
you,
care.
everybody. Thanks,
Bye-bye.
Thank you
everybody.
for the
Thank you
information.
all.
Yes, sir. All right, good night.
Yeah, have a good night.